This country's grown up so fast and they've done great things. They've got a culture of innovation, a culture of people that are so welcoming, so inviting and so humble as well.
We are in the building of Ministry of Health and Prevention in Dubai. Our vision is to provide the right health to the citizen of the United Arab Emirates.
The Ministry of Health is delivering services for around 17 hospitals and 70 primary healthcare centers.
So we partnered on Cerner Millennium, and 70% of our establishments are connected right now, and we're working on the rest.
We want a long-term strategic partnership, that this company is going to work with the ministry for 5 to 10 years.
We have the experience in the delivery of healthcare in the region, and more importantly, we've got the skill set, the team that has the culture here from the Middle East.
They know the culture, and accordingly they are helping us in improving the services provided.
What we're doing here at the ministry is looking at not only having the right tools in place, the right processes in place to ensure we're giving them the right platforms, we're also working on the whole ecosystem itself.
The service has improved substantially. When we had the Cerner IT Works commitment with us, the change happens is that we had a lot of people on the floor for the support. Plus, we have seen that we have actually taken about 3,600 calls. That is an average on a monthly basis.
We were getting support from the third party. However, it wasn't to our expectation. But then with the Cerner taking over, it's a direct contact with Cerner. Usually, they try to solve it on the spot. If not, then they get back within a few minutes, and that's been really helpful.
What I have noticed that Cerner actually is willing to change if the change is the best interest of the patient and helping the staff. So I would say it has been marvelous. They've been approachable and great with us.
The medical staff, nurses, lab technicians and everybody, they have access now and they can actually see the patient information and file and access to the file.
Easy now to have whatever we want, it's whenever we want the information we can get it as soon as possible.
Basically it's in my pocket. When I visit any hospital under MOH, I can see my appointment, I can see my results, and even if I travel outside, I can access my patient portal and I show the result to any doctor.
Both my parents are diabetic and hypertensive, so if I feel that her medical record is accessible to me and to her providers to give her the better health care, I feel I'm doing a great job. It's not for my mom, for every citizen who's living in the UAE.
Another program that we're working with Cerner on, anticipating the population health and seeing where you can prevent any kind of diseases is coming to the region.
The dashboards that Cerner provided, which is integration between our systems and their clinical data. So based on the data they give us, we are able to take decision what we are going to focus on.
We're taking the data and analyzing the need, and we build our service around those needs.
The ministry over the last few years, they've been able to deliver the reports, understand what's happening with their population, understand how their clinicians are delivering care.
With population health management, I will be proactive in providing better health care to the population, not only to my patients.
So with the help of our partners, we are actually developing toward the international recognized facilities.
We will be successful in having one national unified medical record at the level of the United Arab Emirates with the whole concept of a smart UAE.
Getting the data will be much easier because of the interoperability and the health information exchange.
We have better communication between the providers. They have all the information at one point of entry when they go into the system.
It's going to enable not only the physicians and the care providers to have that one patient view, it's also going to give the patient control of their record and control of how they visit and interact with their care providers. I think this is the biggest catalyst for change.
The Ministry of Health and Prevention is going to develop a kind of a system where you and I do not have to seek one physician. We could seek any physician. We could have a better prevention programs and have a better treatment, whether I am in the United Arab Emirates or in Singapore or in the United States or UK.
The great leaders of this country, they having great plans for the healthcare system.